Today is June 24th, Buddy Check Day, and our BuddyCheck24 program reminds you to do your monthly breast self-exam. It could help you find breast cancer at an early stage, which could save your life. And for those diagnosed with cancer, despite the pandemic, it's more important than ever to keep up with your care. And here to let us know more, we welcome Dr. Tyler Gosser, a radiologist with Saint Agnes Medical Center. Doctor, thank you so much for joining us. And we're wondering today whether screenings for breast cancer have been impacted since the start of the pandemic. Did the hospital and the breast center stop doing these routine mammograms when this pandemic started?
Well, we had a temporary hiatus on doing the screening mammography for maybe 6 weeks while we, I guess, kind of got our bearings as to what was going to happen with the pandemic and how long it may last, and just how bad things may get with the virus being so transmissible from person to person. We wanted to make sure that we were, as they say, flattening the curve as best we could. We have already started back and are progressively each week adding more and more screening mammography to go with the diagnostic mammography that we had been doing throughout the whole process. And our plan is to be up to full capacity over the next week or so.
And that obviously that makes sense that some of these, especially the routine screenings, may have stopped because there was obviously so much unknown about coronavirus and how it could be spread. But now that these have started, just the screening and the diagnostic mammograms, what precautions are being taken for women who come in for these screenings, and also for your staff that really works in close contact with patients who come in?
Yeah, so I mean, typical things that we ask everyone to do and have been instituted throughout Saint Agnes Medical Center's system. We ask patients to wear masks when they come to the breast center. We have changed around the waiting room so that appropriate social distancing can take place. And, we obviously are taking extra precautions as we clean the rooms and the machines after every patient. We take the safety of our staff and our patients very seriously. So everything that we know to do and that we can do, we have been doing and will continue to do.
I know there have been some concerns with emergency room doctors and doctors of other specialties that patients were reluctant to come in to see a doctor or go to a hospital because they didn't want to be exposed. Is there some concern that maybe some breast cancer cases have gone undiagnosed throughout this pandemic because maybe women were reluctant to come in and just have their screenings?
Well, I think there's always concern, and I think we always have a tendency to say, oh well, it won't happen to me, but unfortunately it does sometimes. And while we completely empathize and recognize the hesitancy that people feel, it's very important to continue to have these regular screening mammograms, because we do find things every day that maybe have been missed, or maybe patients have delayed care because whether there was other things going on or maybe a little bit of denial or whatever the case may be. It's of utmost importance to get on and stay on a schedule for these screening mammography tests, so that we can find things early enough that they can be treated, and we can find a cure, as we can experience a cure, as opposed to finding them later on when things are much more progressed.
Yeah, and it's more difficult to treat. Well, we know the statistic. I mean, it's a statistic that we've heard so many years, that 1 in 8 women will be diagnosed with breast cancer in her lifetime. So in addition to mammography, what are the best preventative steps that women can take? If you wanted to spread the message to people watching today, what would you tell women? Obviously, get your yearly mammogram when you're of age, but are there any other steps that women need to be aware of?
Well, as always has been the case, just a regular self-check is probably the most effective thing that women can do. No one knows your body like yourself, so probably the first person that's going to find something is you. So if you're doing your regular self-checks and find something that seems to be changing, right, that would absolutely be a trigger for you to reach out to your physician. Or, we offer just walk-in appointments. You don't have to have an appointment from your family physician or your primary care physician. You can just walk into the breast center for a mammogram, and we're happy to accommodate that. So I think that's probably the biggest thing, is that women are continuing to maintain their their monthly self-checks to find something early if there's something does arise.
All right, excellent message, and with today being BuddyCheck Day, we love hearing that message. Thank you so much to Dr. Tyler Gosser, a radiologist at Saint Agnes Medical Center. We appreciate your time today and for that important reminder. Thank you so much.